Hello everyone. We are going to learn something very familiar term today, that is pain, and we are going to learn about the pain management in this session. Okay, so it is going to be very informative, and you are going to learn some sort of new terminologies related to pain. So are you all ready to listen to it? Okay. So what do you mean by pain? Do you all like to have the experience of pain? No, not at all, right? So the term pain is an unpleasant sensory and emotional experience. So it is a unpleasant experience where every individual undergo. So it is an unpleasant sensory and emotional experience which will be associated with actual and potential tissue damage. Actual means what? Actual is nothing but at present there is some potential, there is some tissue damages happening. Potential means what? In future they are prone to get some sort of tissue damage. So the term pain is nothing but unpleasant sensory and emotional experience associated with actual tissue damage or potential tissue damage. So this is the definition for pain. Is it clear to you all? Okay. So let's see some of the terminologies. First is pain threshold. What do you mean by the word threshold? So the amount of pain stimulation a person requires before feeling of pain. What do you mean by that? So if a person he is having the feeling of pain, right? So the moment before he started having the feeling of pain, that is called as pain threshold. Imagine a person is coming and he is pinching you in a forehand. So at one point of time you will start shouting. No, when you are not able to tolerate the pain, you will started to yell at him or started shouting. So that is called as threshold. So amount of pain stimulation a person requires before having the feeling of pain. Before he feels it is pain, the amount he is tolerating, no, that condition is called as pain threshold. That term is called as pain threshold. Clear? So what do you mean by pain tolerance? The highest intensity of pain that the person is willing to tolerate. So the name itself is denotes tolerance means the tolerating part. So the highest level of tolerance he has, that is called as pain tolerance. The highest intensity of pain that the person is willing to tolerate is called as pain tolerance. So you need to know the difference between pain threshold and pain tolerance. Clear? Okay. Let's see some of the different types of pain. So the pains are classified into different types. First, it is classified based on the location. So based on the location, it is classified as your headache, your back pain, your chest pain, and it may be referred pain or visceral pain. So where and all the pain is there, we can have that name. For example, if you have the pain over abdomen, you will call it as abdominal pain. If it is in the forehead, you will call it as headache. If it is in the back, it is called as back pain. If it is in the neck, it is called as neck pain. Or if it is in the chest, it is called as chest pain. So depend upon the location of the body, we will call it as different type of pain. Headache, back pain, chest pain, etc. It may be referred pain or visceral pain. What do you mean by referred pain? Referred pain means the problem will be on one part, but the patient will have pain over the different aspect. Say for example, in case of myocardial infarction, the patient will be having trouble or the myocardium tissues are getting necrosed. So in case of chest pain, patient sometimes will have jaw pain or pain over the back, shoulder, etc. So that is called as referred pain or visceral pain. So then it is classified based on the duration. Based on the onset, we will classify the pain based on the duration. What it is called acute pain and chronic pain. Acute pain is sudden onset. So maybe for 3 months or 0 to 3 months we will call it as acute pain. Chronic pain means more than 6 months. In case of knee pain or any ulcerative pain or some condition, any chronic illness, patient will have chronic type of pain. Acute means sudden onset. Clear? And the third one is intensity. Intensity is nothing but the severity. So we will call it as mild pain, moderate pain and severe pain. We are very much familiar with this word, right? Mild means mild pain with 0 to maybe 1 to 3 level of pain score is the mild pain. Moderate pain means tolerated level. Severe pain is the worsening form of pain. I'll tell you the example. In case of any dysmenorrhea or sometimes during your menstrual cycle or some condition, you will experience some sort of mild pain to moderate pain. In case of appendicitis or in case of peritonitis, you will experience the most worst pain. So which is the severe pain. Okay, so based on the intensity, we will classify it as mild pain, moderate pain, or severe pain. Depend upon the etiology. Etiology means what? Depend upon the causative factor. It may be classified as physiological pain, somatic pain, and neuropathic pain. Okay, some conditions, some long-term condition, autoimmune disorders, some sort of orthopedic illness, and some sort of diabetic patient experience this type of neuropathic pain, which is a long-term pain. So, depending upon the causative or etiological factors behind our body, will make our pain to get differentiated, which is called as what? Physiological pain or somatic pain or neuropathic pain. Okay, so these are different types of pain. And here comes the physiology of pain. So what are all the physiology of pain? So the pain, if a person experiences pain, he has to undergo 4 major steps. How many steps? He has to undergo 4 major steps till he get the pain perception. First step is what? Transduction. I'll explain it to you all one by one. Transduction, where the pain begins. Next is your transmission, where the pain travels through the spinal cord. Next is your perception, where the patient is having the feeling of pain. Modulation, where the pain is controlled. Clear? You have to be familiar with all these terminology. One is transduction, transmission, perception, and modulation. I'll be explaining it to you all in detail in the subsequent slides. So just listen carefully. First thing is the transduction, where the pain begins. What happens here? Any tissue damage or tissue injury, either it could be your burns, your cut injury, or any surgery, or inflammation, or any damage to the cells which is present in our skin. What happens? The damaged cells, right? The damaged cells start to release some sort of chemicals. What chemicals are there? Some pain mediators they will begin to release. Maybe your prostaglandin or bradykinin or histamine. So the damaged cells started to release these kind of chemicals in our body. The prostaglandin, bradykinin, histamine. What happens? These chemicals will stimulate the pain receptors, nociceptors. We call it as nociceptors. It stimulates the pain receptors in our skins, muscles and joints and internal organ, and then those receptors will travel. So up to this phase, during transduction phase, what happened? Any tissue damage, tissue injury, either burns or cut or surgery or inflammation, what happens? The tissue cell damage started to make the damaged cells to release some sort of chemicals in our body. Prostaglandin, bradykinin, histamine, etc. These chemicals will aggregate the pain receptors which is present in our body, skin, muscle, joints and internal organs. Say for example, touching a hot pan stimulate the nociceptors in your fingers. Am I right? So what happens? The damaged cells started releasing some sort of chemicals. Those chemicals will go and trigger the pain receptors, which is a normal receptor which is present in our body. It lies in skin, muscle, joints and internal organs. Then it will go and stimulate the pain receptors. Clear in this phase? Okay. Next is transmission phase. As the name itself very clearly says that here the pain pathway, pain travels. The pain impulses travel from injured area to peripheral nerves. So from injured area to peripheral nerves, it travel to the spinal cord. Where it enters the dorsal horn of the spinal cord, and then it travels to spinothalamic tract, it reaches thalamus, and finally it reaches the cerebral cortex. Everything I will be explaining it to you all with a picture in the subsequent slides. Clear? First phase, transduction. What happens? The pain receptors got stimulated from the scales. Those pain receptors will started to travel through the pain pathway, through the spinal cord in this phase. Okay. What is the third phase? Perception. In this phase only, the patient really started to having the feeling of pain. Okay. So here the brain recognizes and interprets the pain. The cerebral cortex, which is present in our brain, it determines the location of the pain, intensity, and the severity of the pain. Okay, there are some other brain areas are there which also add on to the emotional experience. Say, for example, it provokes some fears, sensation, some anxiety, some sadness state, some stress and all. Okay, so in first phase, what happened? The nociceptors got triggered and it started releasing from the body cells. Second transmission phase, what happened? Those pain receptors had started to travel through the spinal cord. In third phase, after reaching the spinal cord, reaches the spinal cerebral cortex of the brain, and the patient started to having the feeling of, so the patient started to perceive the feeling of pain in himself. Okay. What is the fourth thing? Modulation. Pain is controlled. Do you all imagine some sort of, for example, if some mild injury happened, we will be crying for a while, and then automatically our pain will get subsided, though we take some sort of painkillers or not. Though we take the medicines or not, some pains will become tolerable, will become bearable, and it will automatically get subsided, right? So it's just because of this modulation phase. What happens here? The brain sends some signals back down to the spinal cord to reduce the pain. So the body release again some sort of pain relieving chemicals. What are all those chemicals? Endorphin, enkephalins, serotonin, all those chemicals the brain started to release. These substances block the pain pathway and prevent the patient to have the feeling of pain sensation. So the pain sensation will be reduced automatically. Clear with the four phases? I'll explain it to you all with the help of a diagram so that you'll be understanding it more. So imagine this is the muscle and the patient having some sort of cut injury. So what happened? The injury, the damage still started releasing some sort of substances that will go and trigger the pain receptors from the muscle. Those pain receptors will go and reaches the dorsal horn of spinal cord, which reaches into the, so it travels through the spinal canal tract, it reaches the thalamus, then it reaches the cerebral cortex, which is present in our brain. Then the patient will have the feeling of feeling of pain, because from here to there it will be taking in a fraction of a second. So patient will have the feeling of pain. As soon as what happened, the brain started releasing some sort of chemicals. Those chemicals will get released from the brain. Again, it reaches to the end point, and that substances will alleviate the pain. So the patient will automatically, the pain will get reduced. So it is called as the pain pathway. We will commonly called as gate control theory. During pain, the gate opens, the neuroreceptors transmitted through the spinal cord, through the thalamus into the cerebral cortex of the brain. Again, some sort of substances, chemicals will get released from the brain. Again, it travels, it reaches the spinothalamic tract and it gets the end point, and it also prevents the patient from having the feeling of pain. Clear? This is the pain pathway which we commonly see. This is the gate control theory mechanism. So what we'll see the gate open during the increased pain stimuli, and the gate will be closed during reduced pain signals, inhibition of pain pathway. Okay, so this is the diagrammatic representation of gate control theory, which is a very common theory for pain. You got the concept? Okay. Now here comes the assessment part. How do you assess the pain? You will have to thoroughly assess the pain. Just like that, you cannot go and ask the patient, oh, you are having pain. How many days you are having? Okay, fine. So that is not the case. You have to in-depth or thoroughly you have to assess the pain. How do you assess? We have a mnemonic called cold spot. What is the mnemonic called? Cold spot. You have to assess the characteristics, onset, location, duration, intensity, all the aspects you have to assess. So we have some sort of rating scales with which we can assess the pain scale. The first rating scale you are seeing now, that is called as numeric rating scale. We have a number which is there in the scale, and we have to go and give this numeric pain scale to the patient, and we have to ask the patient to tell in what kind of pain they are at right now. Like that, you have to go and ask them. If the patient says 0, it is no pain. If the patient says between from 1 to 3, that indicates mild pain. If it is from 4 to 6, it is moderate pain, and 7 to 10 is your severe pain. Depend upon the patient says, you can using this numeric scale, you can mark patient is having mild pain or no pain or moderate or severe pain. Clear with the thing, numeric pain? Okay. Second is your Wong-Baker scale that is being commonly used for pediatric cases. So depend upon the facial grimaces or facial expression, we can mark the patients. We can mark the pain score. Okay. So say for example, patient is in this case, we can say 2 out of 10. If the patient is having severe pain, either they may be what to say, crying, or they may be frowning. So you can put 8 out of 10 or 10 out of 10 for the pain. Okay, this is the Wong-Baker's facial index scale, which is very commonly used for pediatric patient pain assessment. Next, we have something called flat scale, again used in pediatric part. So that include your F is for face and L is for leg, A for activity, C for cry, and again C for consolability. Depending upon this is also used to assess the pediatric pain. So because pain is very common in case of pediatrics, whereas the adult has the tolerance power, they have a more threshold and they have more pain tolerance, they will tolerate. Whereas in case of immature pediatric, everything very immature, so patient will not be tolerated. So we have to assess and we have to give them the treatment, the management very carefully depending upon their pain level. For that only we have these many kinds of pain scale. So in the scale it will be very clear that face, no particular expression, patient is like that means 0. In case of occasional grimace or occasional frowning means you can give 1 score, and frequent to constant frowning, clenched jaw and queuing chin means you can give 2. So by seeing face itself you can categorize 0, 1, 2 like that. By seeing the legs, normal position relaxed means 0 score, and uneasy and patient is very restless tense means you will be giving 1 score, and kicking or always leg or drawing up and is frequently kicking up, not able to tolerate the pain means you will be giving 2 score. What about the activity? The child is lying quietly in a normal position, moves very easily means 0, and the child is quivering, shifting back and forth, very tense means 1, and the child is arched, something very peculiar. Arched means the body itself will be like a arched position. That might that kind of intolerable pain he is maybe experiencing. So arched position means definitely you have to give 2. Cry, no crying means 0. Moans or whimpers means 1. Crying steadily or screams or sobs very frequently means 2 score. Consolability means content very relaxed means 0. Reassured by touching, hugging, being or talking to some sort of diversional activities, patient we can able to console means 1. Not able to console the client means you can give score as 2. So this is the flat scale. Okay. Coming to the nursing diagnosis part, what are the diagnosis? Obviously, you will be writing pain. Pain related to physical trauma. Pain is the pain related to physical trauma or surgical intervention. Second, ineffective airway clearance related to weak cough secondary to post-operative incision abdominal pain. In case of any post-operative patient, we can have ineffective airway clearance due to post-operative pain. Definitely you will have anxiety because pain is not at all subsiding. Either that could be some any underlying disease or not. So kandipa they will be in very worrying situation. You need to put diagnosis for the anxiety part. And ineffective coping related to prolonged continuous back pain. They may not cope with you because they are experiencing severe pain. They may not cope with you. So ineffective coping and self-care deficit. They cannot able to do the daily activities. So they definitely they have self-care deficit. These are all some of the nursing diagnoses. Again, we have impaired physical mobility related to arthritic pain and insomnia. What do you mean by insomnia? So not able to get adequate sleep. So they have sleep intolerance due to increased pain perception, especially at night. These are all some of the possible nursing diagnoses for such kind of patients. Here comes the intervention, the management. You have to go with non-pharmacological therapy. What is non-pharmacological therapy? Some alternative therapy we get to start initially. Then cutaneous stimulation. We have something called TENS, transcutaneous electrical nerve stimulation. Advanced therapy are there nowadays. So without any physical or the medical management, it's all external application where the long-term pain will get subsided. Ice and heat application we can go in for, and I already told you, transcutaneous electrical nerve stimulation. We call it as TENS therapy. We can opt for that, and distraction therapy, diversional therapy, relaxation, deep breathing, coughing exercise, guided imagery we can give, and acupuncture. Other therapies are booming nowadays. So one among such things is acupuncture and biofeedback mechanism. These are all non-pharmacological. Without any medical interventions, we can go for this therapy. Some pharmacological therapy also we can go. Later on only we have to start. start initially, we have to go with the non-pharmacological therapy. We have other therapies also called psychotherapy, music therapy, art therapy, aromatherapy, massage technique and meditation. All these techniques you have to start with the initial thing for any long-term pain or chronic pain. Then pharmacological therapy, we have WHO ladder. So you have to start with non-opioids and then cater to opioids for mild to moderate pain and then cater to more opioids for moderate to severe pain. So this is the ladder. Straight. You cannot start opioids for at the beginning itself. You have to start with non-opioids, then mild opioids, then severe, moderate to severe pain opioids you have to prescribe. Okay, so these are some of the examples. So for non-opioids, we have what? Acetaminophen, diclofenac sodium, aspirin and all. For mild opioids, we have codeine, tramadol. For moderate to severe pain, we have morphine, fentanyl, pethidine, ketamine for severe form of pain. Clear? So this is how you have to cater the pain pharmacological management. So along with that, co-analgesic can be prescribed, which is called as adjuvants. One is your antidepressant, and steroids you can give in case of arthritic pain. Anticonvulsant can be given, muscle relaxant can be given in case of spasmodic pains, and stimulants also can be prescribed along with the painkillers. Okay. Next, routes. In which are all the routes we can administer? We can administer through oral or rectal or transdermal patches, IV medications, IM, subcutaneous and intrathecal or epidural route, which is very common in post-operative condition. Okay. What are all the side effects for opioids? Definitely patient will be having constipation, nausea, vomiting. Some sort of sedation effect will be there for long period of time. Respiratory depression, very important, respiratory depression. So we need to monitor the patient. We use on narcotics or opioids. So we need to monitor the respiratory rate. Pruritus will be there. Urinary retention also will be there for some sort of patient. And the surgical interventions in case of long-term pain which is intolerable, not responding to medical management, we can plan for surgical intervention. One is the cordotomy and rhizotomy. They will remove the nerve endings of that particular region. Thereby patient will be relieved from pain. So these are all some of the surgical interventions. Clear? So in our session we have seen what is pain, what are the different types of pain, what is the pain pathway, how our body react to pain, how we have to assess the pain using different type of pain scale, what are all the management starting with non-pharmacological, pharmacological and surgical, and we have also saw about adjuvant therapy. Hope this session is very useful to you all. So do watch our upcoming sessions on interesting and informative medical and surgical conditions. Okay, thank you.